Good morning. I'm Joe Sawyer, President of Robert Packer Hospital. I'm here today with Mike Hogan, Vice President of Support Services at Robert Packer. We'd like to spend a few minutes to update everyone on how we're securing our supplies and our personal protective equipment during this crisis. I'd like to give everyone a little update on what we've been doing to monitor our supply usage during these times. A few weeks ago, we went out to every facility and did eyes-on inventory of all our personal protective equipment. We've then developed a listing of the most top 10 critical supplies that we monitor twice a day. We have automated reports that run at 10 a.m. and at 6 p.m. at night to monitor the usage or the burn rate. We've been calculating our burn rate and monitoring closely all our usage across all our personal protective equipment. We've also done some innovative things like bulk purchases. So we have hundreds of thousands and tens of thousands of PPE coming in within the next several weeks. Mike, would you like to talk a little bit about how we're securing all the products that we're bringing in?
Facing a crisis like this, we've needed to basically rely on a couple of different sources. One is our regular supply chain vendors, who, again, we've had long-standing partnerships with here at Guthrie, and they continue on a fair allocation process to be able to provide us some of the PPE items that we need. One of the other great benefits of being a part of an organization like Guthrie is we've been able to tap into the resources that our resource development group has in the community to be able to provide us extra PPE items.
Hi, I'm Tricia Houston. I'm the Director for Resource Development at Guthrie. And I just wanted to share with you a few of the ways in which people are supporting us right now during the COVID-19 crisis. It's been really incredible to see our community rally around our healthcare organization and support us in so many different ways. We've had more than 40 companies across our service areas donate things like personal protective equipment, gloves, hand sanitizer, and other things as well. People have offered to donate the use of their buildings, their parking lots, whatever they can do to support us during this time. It's really been incredible. We have also established the Guthrie Emergency Response Fund. So for folks who want to make a difference and want to support our organization right now and maybe can't donate personal protective equipment, we are welcoming monetary support, and this allows us to put these resources into use as quickly as possible and get them where they need to go across the health system.
If you look around this warehouse, the items that we're standing in front of are all PPE items that have been provided to us by our resource development contacts in the community. A variety of different organizations have stepped up in this time of need to help Guthrie so that we can help care for our patients. And so what we have done in our department is, again, we track all of those inbound donations as well as those inbound deliveries, working with supply chain. We are securing those items here, inventorying those down to the count so that we can feed that information into the process that Joe mentioned earlier, so that when those reports run, we have an accurate assessment of the inventory, and that helps translate into a number of days on hand to continue to provide the care that we do.
So Mike, let me take a moment to also explain about fair share allocation. So as everyone is aware, this is a global issue. Our supply chain suppliers have had some issues in order to get it from manufacturing facilities. And believe it or not, many manufacturing facilities of our personal protective equipment are from overseas, some primarily in China. As each of our distributors have given us our fair share allocation, meaning if we ordered a supply of 10,000 through our normal supply chain, they're not allowed to give us the 10,000. They would only be required to give us what our fair share allocation is based on our last 3 months of normal usage. So as that has been a potential hindrance, that's why we've done some unique bulk purchases, so that we're trying to have our supply for the foreseeable future in case there's continued disruption after this crisis is over.
And Joe, let me add to that. One of the other things that we're doing, and again, this is part of our the strength of being in this community, having the community-based partners that we do. we have had several manufacturers in the region step up and come to Guthrie and offer to make prototypes of face shields, introduce new processes around UV sterilization of our gowns. And so we've been able to really rely on multiple manufacturers that have brought us and manufactured for us specifically for Guthrie and for use in our facilities, things like hardened face shields, surgical mask. We have teams out there that are sewing. We have teams out there that are cutting, binding, putting these things together, and again, bringing these supplies to us so that we can use them for the care of our patients.
So just in wrap up to summary of what we discussed here today, that our supplies and personal protective equipment are a top priority for the organization. Protecting our staff and the patients that we serve are really what matters most. Thank you.